Hi, my name is Kingsley Thompson. I have been coming to Movement Chiropractor for about 4 or 5 months now, and I've been really enjoying it. I was having sciatic nerve issues, so I had a baby about 2 years ago, started working out soon after that postpartum at a local place here, and it was probably more aggressive than I've had in the past. And so as I got further into working out, I just noticed that I was starting to have sciatic nerve issues and came in here and they've been working on it since then. So my pain level now, I will have flare-ups. I'll start that way. I'll have flare-ups maybe once every other week or so. It's essentially on a scale of 1 to 10, having had a baby in my mind, comparing that, it would still be considered like a 4 or 5, but it was constant. It was almost, if I was in the car for longer than 10 or 15 minutes, I was in just agony because I couldn't sit without straightening my leg. And so it started to move down. However, we weren't quite sure what was going on. And about 2 months in, just shortly, right before I started to do the SoftWave, I was really feeling it decrease, and really more so on the flare-ups, less flare-ups over time. There would be longer amount of time of my leg flaring up, of having any pain with the sciatic nerve, and yeah, so it would go from when I started at Movement, it was pretty much constant, and slowly over time, for about 2 months, I would have some really sharp pain every once in a while as they were adjusting me, and then SoftWave really has helped me to not have that flare up. It would be maybe once every 2 weeks it would come up. I've done SoftWave for the last about 8 weeks, almost once every week, and it's been great. It's really helped me. We've been able to increase the level over time, and it's been a huge help. Taking other pain outside of what this was doing to me, it was high. I mean, it would get to a point where I was pretty immobile, so I would consider that like 7.5, 8 in pain tolerance or pain level. And then it slowly was getting more mild over time. And now, like what I would consider a flare-up of my leg would be a pain of like a 2. So SoftWave was really where I was starting on the downhill. I was getting less flare-ups and way less intense. So really for chiropractic care, it took about like 6 or 7 weeks of coming in twice a week and having a little bit of discomfort throughout that like longer term in between adjustments, and then I got there. So I would say about like almost 8 weeks. I've been able to move better outside of here. It's been a huge blessing for me to be able to, whether that is in my work, I'm a flight attendant by trade, so I am doing a lot of moving around and lifting, and so I have been able to perform my job a little bit better, longer stretches of the day. Carrying my son, who's over 30 pounds, and carrying him up. Before, I would struggle bending over and picking him up, and I don't have that. And then the biggest thing is being able to get back into working out. I really, for a little while here, while we were doing chiropractic care, we stopped. They told me to, take a little bit of a break and see what happens from there with movement, and it really helped. My body, I feel like, was able to just readjust and reset. I think there's a huge benefit anyway. I'm obviously a proponent of chiropractic care. One, and just like a holistic, I feel like I'm healthier overall. I get sick less, and I know there's lots of science behind that, and so that's a huge proponent for me that I really will speak towards. And then what Movement does a great job with is not necessarily focusing on, hey, you need to come every week or you need to be here multiple times every week. It's focusing on what is really like hurting me and what's a problem outside of normal everyday life, and correcting that. And they're a huge proponent of like a healthy, active lifestyle, which is huge. And I've been to other chiropractic care places around here in the Atlanta area, and this has been the best way to like introduce being active and healthy. And that's coming from me, you know, but then also they're supporting that and helping my body to, you know, get back into the movement and what I should be doing every day. So SoftWave, and I mean, I didn't know anything about it, and I was kind of in the baby stages of it, so it was taking a good bit of a risk. But so the biggest thing with SoftWave is, you know, they're fine. They don't know exactly where your tender and where the pressure is on your body. But what I've seen, like the longer we've done it, she'll pinpoint a spot that's tender and it's almost unbearable to sit through. And then the next week that spot's completely gone and healed. And it's almost like, so mine was in my glute down to my thigh, basically, is where we started. And I've noticed the longer she'll do it, it's almost like it's just being pushed out. And then the more I'm adjusted, and that is really, it's just gone away. The pain has gone away. So yeah, I'm a huge proponent of it. I don't have the science background but it's worked for me, and I can tell that growth has happened with the soft tissue and everything. So